Clinical is like a box of chocolate. You never know what you're going to get. Hey guys, how's it going? Welcome back to my channel. As you can see, I am wearing the same thing. I start my preceptorship this week, so I know I'm going to be very busy and I won't have much time to film, so I figured why not knock out 2 videos in one day. So of course this video is going to be all about my clinical experience and also just how to overcome being shy. So first things first, HIPAA. HIPAA is very, very, very important. You do not want to violate HIPAA. Your school will probably beat patient confidentiality into your mind, so you will remember it at all times. You don't want to be taking pictures in clinical, especially if there's possible patient identifiers on the wall, like their name, room number, any of that stuff. You don't really want to take pictures of your patient. If you do, you need written consent. And let's say, for example, I had a patient in a children's hospital. She was the cutest little thing, and her family gave consent for the hospital to use their pictures when Make-A-Wish Foundation came to the hospital. Mickey Mouse came, all that stuff. It was really cute. I was actually in a picture with my patient, and I saw that the hospital posted it, but I did not repost it to my social media accounts because I felt like the family gave the hospital permission to use those pictures, not me. Now, it probably would have been okay, I don't know, but it just was not something that I felt like was worth it. I was not going to test that. Also, you do not want to be talking about your patients in the elevator, or on the bus, or just outside clinical. It is okay to discuss your day with your clinical group during post-conference, but outside of that, you should not be going on about, oh, my patient's name was Jane Doe, and she did this, and she had this, and oh my gosh, let me tell you. That is not okay. Don't do that. So another thing is you want to be professional at all times in clinical. When I say that, I'm talking about the way you look, the way you act, and the way you speak. You are going to deal with some things you may have never dealt with before, such as death or taking care of a patient in a lot of pain. So you want to be careful with what you say, how you say it, when you say it. You're going to learn all about therapeutic communication, which will help you talk to your patient the proper way. Also, you are going to probably see some scary things. You are probably going to have to do nasty things like clean up vomit. You are going to smell horrible things. So keep in mind what your facial expressions are. You don't want to be frowning and just have this pure look of disgust on your face, because your patient may, they're going through a lot. They may be embarrassed. You don't want to make them feel worse, right? And as far as the way you look, you want to make sure your clinical uniform is ironed, it's clean. You want to make sure you have the right outfit on. And make sure you have your badge, your clinical bag with you, everything you need in your clinical bag, such as your stethoscope, paperwork, pen, pencil, all that good stuff. But I will say make sure you do not bring anything valuable to clinical, such as jewelry or your laptop. You're not going to need that. You may not get a locker. There may be very little space. You might just have to put your bag underneath the table or something in the lounge room. So you don't let anyone, I'm not going to say anybody's going to steal your stuff, but you never know. So don't bring anything valuable to clinical. Don't have your cell phone out on the floor, texting. That's not going to look good, because remember, you are a reflection of your school and the hospital. Another thing, do not make assumptions about your patients. If you happen to have like a Latino patient and you're not fluent in Spanish, don't go up to your patient saying, oh, ¿cómo estás? Hola. And then your patient's just looking at you like, hi, how are you? Your patient may not speak Spanish either. So don't make assumptions about your patient, because then you're going to be embarrassed and you're going to look bad, right? Don't be that student, because I promise it has happened. So I will say that your unit, your nurse, and your patient can make or break your day. You may have the best nurse ever who makes sure you see and do all the cool things. You may have the sweetest patient ever. Or you may have a nurse that has 4 patients, she's super busy, she doesn't have time to babysit you, so you may feel like you're being a little overlooked. And you may have a patient that's pretty grumpy because they're going through a lot of things and they may not be the nicest. No matter what day you're going through, just remember it's just an 8 or 12 hour shift. You're going to get through it, so just remain professional at all times. Keep that smile on your face, be polite. So I'm sure you guys are wondering what a day in clinical is like. There is no simple answer to that. Clinical is like a box of chocolate. You never know what you're going to get. You may try to follow a routine. For example, let's say you're doing a 12-hour shift. You may get to the hospital about 6:30, 6:45 in the morning. And you'll meet with your clinical instructor and your clinical group. Then about 7 o'clock, after you get your assignment, the nurses will probably huddle. The night nurse will give a report to you and your new nurse that just came in. And then you'll probably go do your assessment and vitals on your patient, maybe give your patient a bed bath or offer change their sheets, something like that. Then you'll probably do a little bit of paperwork and then maybe go to rounds. If you don't know what rounds is, that's basically when you meet with the doctor, the nurse, and everybody on the team for your patient, and you just discuss what's going on with your patient and what the future plans are. So that can be either in one room with everyone, or sometimes the doctor and the team will go from patient room to patient room, so you just wait for the doctor to come. So after that, you may do meds with your nurse, just checking your patient every few minutes to see if they need anything. Then you'll probably, do vitals again, then go to lunch. When you get back from lunch, you'll probably do afternoon meds, see if your patient needs anything else. Sorry, I got distracted. See if your patient needs anything else. And yeah, you just kind of go with the flow. You don't really know what to expect. Then you'll probably do vitals one final time before you leave the floor and go to post-conference. That's usually the routine, but like I said, you never know what's going to happen. And it can be different too, like if you're on a children's floor or the adult floor, if you're in ICU, if you're in a mental health facility. So it really just depends. Now, for the last thing that I want to speak about, that would be, what if you're shy? Now let me tell you, I am like the shyest person you'll ever meet. I can't even believe that I'm making videos on YouTube. So clinical was really hard for me, especially my first semester. I was really worried about going into my patient's room when they're sleeping. I was worried about introducing myself or just going in there and doing the assessment because, you just have to get right up in there. Like I say, nursing school is like Nike's slogan, you just do it. So as far as getting over being shy, I wouldn't say there's like just one way to do it. You really just have to go to clinical, do what you gotta do, and as time goes on, you'll be more confident, you'll get used to it, and you won't be as shy. And I will say, when you when you go to clinical, you really just have to get right in there. It's pretty much like this in the morning. You knock on your patient's door, and you go, "Hi, I'm Alexis. I'll be your student nurse today. By the way, when was your last bowel movement?" Yeah, so you have to ask them pretty invasive questions. You may have to look at their body, and I'm sure your patient's they're either going to be used to it or they may be uncomfortable, but you got to get right up into it. You're going to have to maybe, like I said, clean up vomit, clean up poop. That's just how it is. My first day of clinical, I had to give a man a bed bath. In my mind, I was like, oh my gosh, oh my gosh, oh my gosh, oh my gosh, oh my gosh. But like I said, you have to be professional. So I just did what I had to do. I watched my facial expressions. I didn't have a look of disgust on my face, even though it was my first time doing it and I was pretty worried. I just did it. I would say second semester I became a lot more comfortable, and I think what helped me was my mental health rotation. So in this rotation, you're a lot less hands-on. You don't touch your patients at all. So what you do is you just go on the floor and you have to talk to your patients. You may have patients with Alzheimer's, schizophrenia, substance abuse problems, bipolar disorder, all that stuff. And my teacher would, you didn't know what floor you were going to be on until you got there, so my teacher would just walk you to your floor, introduce you to the nurses, and then go, bye. So you're just there either by yourself or with one or two other classmates. And you literally have to just walk up to patients and start talking to them. You have to ask them, you first get them comfortable, you have to build rapport with them first, right? But then you may have to start asking them pretty private questions, things that they may not want to talk about, but for the most part, they're pretty open to it. And I think that's what really helped me stop being shy. It was really hard for me to just go up to strangers and start talking to them, but like I said, as time goes on, you'll get used to it. So like I told you about the bad bathroom on my first day of clinical, I was like, oh my gosh. But second semester, I had an Alzheimer's patient who went to the bathroom, and of course he could not wipe himself, so guess who had to do it? Me. And this time I was not freaking out as much because, like I said, I was used to it. So maybe just for like the first 5 seconds, I was like, oh my gosh. But you know what I did? I got up in there and I helped him out because he really needed the help. He didn't know what was going on. He was confused, and you know, someone's got to do it. At the end of the day, you're doing something great for these patients. You will get used to it no matter how disgusting it may seem now, no matter how scary it may seem now, you will get used to it. And by the end of nursing school, or maybe even by the end of the first semester, you're just like, that was nothing. So as far as being shy, you really just, you have to go in there and do your assessment. Even if your patient is sleeping, you have to go in there and do those vitals. Don't be afraid. You will get used to it. You will get through it. So I think that's pretty much everything that I wanted to cover. If you have any questions, let me know, and once again, I'll be happy to answer them. I'm sure you'll do great in clinical. Just remain professional, remain confident, ask questions, advocate for yourself when it comes to working with your nurses, and you'll be fine. So I hope this video helped you out, and have a lovely day. By the way, when was your last bowel movement?